Every year, thousands of people over 65 are told the same thing by their doctors. Walk more. Get your steps in. 10,000 a day if you can manage it. And for decades, that advice made sense because walking seemed like the safest, easiest way to stay mobile and keep your heart ticking. But here's what nobody mentions during those quick clinic visits. For a growing number of older adults, walking isn't just hard on the knees or boring. It's actually less effective than a movement you can do in your living room in 5 minutes without ever taking a step. And when a cardiovascular surgeon in Ohio saw the circulation scans after his own patients tried this trick for just 2 weeks, he didn't believe the results at first. He ran the tests again. Same outcome. Better blood flow. Stronger leg tone. Less joint pain. All from something that looks almost too simple to work. Now, before we go any further, drop a comment right now and tell me your age and where you're watching from. I want to know who's here because the advice I'm about to share changes depending on whether you're 65 or 85, whether you live somewhere flat or hilly, whether you've had a knee replacement, or you're just starting to feel that morning stiffness everyone complains about. So go ahead. Age and location. I'll wait. All right. So why is walking losing its crown as the go-to exercise for people over 65? 3 reasons, and none of them are your fault. First, walking is a forward-only movement. You go straight ahead, you come back, and that's it. But here's the problem. Your body doesn't just move forward. You twist to look over your shoulder when you back out of a parking space. You sidestep to let someone pass in a narrow hallway. You reach up to grab a dish from the top shelf. Those movements require rotation, lateral strength, and range of motion that walking never trains. So, over time, even if you're hitting your step goal every single day, you're getting weaker in the directions that actually prevent falls. Second, walking is weight-bearing in a way that loads the same joints in the same pattern over and over. If your knees, hips, or lower back already have some wear and tear, and let's be honest, most people over 65 do, then adding more steps can accelerate the breakdown instead of building you up. And third, walking doesn't challenge your balance in a controlled way. You're upright, you're moving, but you're never on one leg for more than a split second, and you're certainly not testing your stability while your brain is also trying to coordinate something else. Now here's where it gets interesting. The 5-minute trick I'm about to walk you through does all 3 of those things walking misses. It trains you in multiple planes of motion. It builds strength without pounding your joints, and it improves your balance while your nervous system is actually paying attention. The technical term is dynamic postural control, but all that means is teaching your body to stay steady when life throws you off balance. And for someone over 65, that skill is worth more than 10,000 steps because it's the difference between catching yourself on the edge of the tub and spending 6 weeks in a rehab facility. So, what is this 5-minute movement? It's called the supported stand and shift sequence, and it comes from a combination of physical therapy protocols and something much older. Japanese longevity practices that emphasize small, frequent, intentional movements instead of long bouts of cardio. The surgeon I mentioned, his name is Dr. Feldman, he started recommending it to patients who were too deconditioned to walk more than a block without getting winded. He figured it was a bridge exercise, something to get them strong enough to walk later. But then he noticed their follow-up labs. Circulation markers improving. Leg circumference increasing, meaning muscle was coming back. And the patients themselves reported feeling more stable on stairs and in the shower, places where a fall can change everything. So he kept digging and eventually partnered with a university rehab lab to track the results more carefully. What they found was that 5 minutes of this sequence, done every morning, produced measurable improvements in lower body strength, balance confidence, and vascular flow within 2 weeks. And here's the kicker. The improvements were greater in some metrics than what they saw in a comparison group who added 1,500 extra steps per day to their routine. Let me tell you about Margaret. She's 71, lives in a 2-story house outside of Cleveland, used to be a school librarian. She loved walking, but her right knee had been bone on bone for about 3 years, and she kept putting off the replacement surgery because she was terrified of the recovery. Her daughter bought her a pedometer, and Margaret tried. She really did. But every afternoon after her walk, her knee would swell and she'd spend the evening with ice packs and ibuprofen. She felt like she was stuck between doing nothing and doing damage. Then her cardiologist, who happened to be in Dr. Feldman's practice group, suggested the supported stand and shift sequence. Margaret was skeptical. 5 minutes instead of 30-minute walks? It sounded like a downgrade, but she agreed to try it for 2 weeks. No other changes. By day 10, she noticed she could go up her stairs without holding the railing with both hands. By day 14, the afternoon knee swelling was gone. At her 1-month check-in, her resting heart rate had dropped by 6 beats per minute, and her grip strength, which they measure as a proxy for overall vitality, had gone up by nearly 15%. Margaret still doesn't walk long distances, but she does her 5-minute sequence every single morning before breakfast, and she told me last month that she feels more solid on her feet than she has in 5 years. So, how do you actually do this? I'm going to walk you through the sequence step by step, and I'll give you modifications depending on where you're starting from. You'll need a sturdy chair or a countertop you can hold on to, a flat, non-slip surface, and a timer. That's it. No special equipment. No gym membership. No fancy shoes. Step 1. Stand behind the chair and rest your fingertips lightly on the back of it. Not gripping. Not holding your weight. Just touching for reference. Feet hip-width apart. Now shift your weight slowly onto your right foot and let your left heel come off the ground about an inch. Hold that position for 3 seconds. Feel your right ankle, calf, and hip doing the work to keep you steady. Then shift back to center and do the same thing on the left side. That's 1 cycle. You're going to do 10 cycles and it should take about 90 seconds. The goal here is not to lift your foot high. The goal is to feel the muscles around your ankle and hip fire up to stabilize you. If you feel wobbly, that's normal. That wobble is your nervous system learning. If you need to press down harder on the chair, do it. Over time, you'll use less and less support. Step 2. Same position, fingertips on the chair. This time, you're going to do a tiny side step. Shift your weight onto your right foot. Then slide your left foot 6 inches to the left. Bring your right foot over to meet it. Now reverse. Slide your right foot 6 inches to the right. Bring your left foot over. That's 1 cycle. Do 10 cycles. Should take about 60 seconds. This trains lateral movement, which is something walking never does. And it fires up the muscles on the sides of your hips, the ones that prevent your knee from collapsing inward when you step off a curb or catch yourself from tripping. Step 3. Still at the chair. Now you're going to add a twist. Shift your weight onto your right foot. Lift your left heel slightly, and at the same time turn your shoulders gently to the left as if you're looking over your left shoulder. Hold for 2 seconds. Come back to center. Now shift onto your left foot, lift your right heel, and twist your shoulders to the right. That's 1 cycle. Do 8 cycles. About 75 seconds. This is where you're integrating balance with rotation, and it's incredibly useful for real life. Think about turning to grab something off a table behind you or looking behind you while you're standing in line. Those movements require your brain and your body to coordinate stability and rotation at the same time. Step 4. The final element. You're going to do what's called a supported single leg hold. Shift all your weight onto your right foot. Lift your left foot completely off the ground, just an inch or 2. You can bend the knee slightly or keep it straight, whatever feels more controlled. Hold for 10 seconds. Use the chair as much as you need. Then switch sides. Do 3 holds per side, alternating. About 90 seconds total. This is pure balance training, and it's one of the strongest predictors of longevity in older adults. If you can stand on one leg for 10 seconds without support, your risk of early mortality drops significantly according to research from multiple medical centers. But even if you need the chair right now, the act of practicing this every day will build the strength and coordination to eventually do it unsupported. That's the full sequence. Add it all up and you're looking at about 5 minutes. You can do it in your pajamas. You can do it while your coffee brews. You can do it while you're on a phone call if you want. The key is consistency. Every single morning. Your body adapts to what you ask of it regularly, not occasionally. Now let's talk about why this works better than walking for a lot of people over 65. especially if you're dealing with joint pain or you've been sedentary for a while. Walking is a rhythmic, repetitive activity. It's great for endurance, and it does get your heart rate up if you go fast enough or far enough. But it doesn't challenge your neuromuscular system in the same way. When you walk, your body is on autopilot. Your brain isn't problem-solving. It's just maintaining a pattern. But when you shift your weight, step sideways, twist, and balance on one leg, your brain has to actively coordinate muscle firing in real time. That coordination is what builds resilience. And for people over 65, resilience is more important than endurance because resilience is what keeps you independent. It's what lets you recover when you stumble. It's what prevents that stumble from turning into a fracture. There's also a vascular benefit that surprised even Dr. Feldman. When you shift weight slowly from one leg to the other and hold positions that require low-level sustained muscle contraction, you're activating something called the muscle pump. Your calf muscles in particular act like a second heart, squeezing blood back up toward your torso. In older adults, that pump often gets sluggish because of inactivity or because walking doesn't create enough varied muscle engagement. But when you do these supported holds and shifts, you're essentially wringing out the tissues and refreshing the blood flow. In some analyses, improvements in lower leg circulation can be measured within 10 days of starting a routine like this. And better circulation means less swelling, less achiness, faster healing, and more energy. Here's the other thing. Walking requires a certain baseline of fitness. If your legs are weak or your breathing is poor, a walk around the block can feel like a mountain climb. But this 5-minute sequence meets you where you are. If you can stand, you can do it. And because it's short, you never hit that point of exhaustion or discouragement that makes people quit. Margaret told me she stuck with it specifically because it didn't feel like exercise. It felt like a ritual, a small thing she did every morning that made her feel capable. And that psychological component matters more than most doctors realize. If an activity makes you feel weak or defeated, you won't keep doing it. But if it makes you feel stronger every single day, even in tiny ways, you'll keep showing up. Now, I want to talk about falls for a minute, because this is the elephant in the room that nobody wants to discuss. Every year, 1 in 4 adults over 65 falls. That's not a scare tactic. That's data from the Centers for Disease Control. And of those falls, about 20% result in serious injury. Broken hips, head trauma, loss of independence. The thing is, most falls don't happen because someone tripped over a rug or slipped on ice. They happen because the person's balance and reaction time had been quietly declining for months or years, and nobody noticed until it was too late. Walking doesn't reverse that decline because walking doesn't train the specific systems that prevent falls. But targeted balance work does. And the supported stand-and-shift sequence is targeted balance work disguised as something so simple you might not even think it counts. Let me give you another story. Robert, 79, retired electrician, lives alone in a ranch-style home in Michigan. He was walking every day, sometimes twice a day because his doctor told him it was good for his heart. And maybe it was. But Robert fell twice in 3 months. Once getting out of the shower, once reaching for something on a high shelf. Both times he caught himself on furniture and didn't get seriously hurt, but it shook him. He started moving more carefully. He started avoiding activities. He stopped going to his woodworking shop in the garage because he didn't trust himself on the concrete floor. His daughter found my content and sent him a video about this 5-minute sequence. Robert thought it looked silly, but he tried it anyway because he didn't want to fall again. Within 3 weeks, he noticed he could stand on one leg to put his socks on without holding the dresser. Within 6 weeks, he felt confident enough to go back out to his shop. He still does the sequence every morning, and he told me it's the only exercise he actually looks forward to because he can feel it working. Now here's a question you might be asking. If this is so effective, why isn't every doctor recommending it? Honestly, there are a few reasons. 1. It's new in the sense that it hasn't been packaged and marketed the way walking has. Walking has decades of public health campaigns behind it. 2. Most doctors have about 12 minutes per patient. They don't have time to teach a 4-part movement sequence, so they default to the simplest advice. Walk more. And 3, there's a bias in medicine that older adults need gentle, low-intensity activity. But gentle doesn't always mean effective. Sometimes what an older body needs is precise, challenging, short-duration work that wakes up the systems that have gone dormant. Dr. Feldman himself said in a lecture, "I listened to last year that the biggest mistake we make with patients over 65 is underestimating what they're capable of." He said we tell them to walk because we assume they can't handle anything more complex. But balance training isn't more complex. It's more focused. And focus is exactly what the aging nervous system needs. Alright, let's talk about modifications because I know some of you watching are thinking, this sounds good, but I'm not sure I can do it. Maybe you've had a stroke. Maybe you use a walker. Maybe your balance is so shaky that even standing with support feels risky. Here's the beautiful thing. Every single step of this sequence can be scaled. If you can't lift your heel off the ground, just shift your weight without lifting. The muscles still engage. If you can't do a side step, just lean your hips gently to one side and back. The lateral muscles still fire. If you can't hold a single leg balance for 10 seconds, hold it for 2. Or keep both feet down and just shift 90% of your weight onto one side. Progress isn't about doing it perfectly. Progress is about doing it consistently at whatever level your body allows today, knowing that next week your body will allow a little more. And if you have serious balance issues or a history of falls, do this near a corner where you can touch 2 walls, or do it with another person nearby. There's no shame in making it safer. The point is to challenge your system without creating risk. Over time, as your strength and coordination improve, you'll naturally need less support. But even if you always need the chair, you're still getting benefit. You're still training the pathways that keep you upright. One more thing I want to mention. This sequence works even better if you pair it with one simple habit. After you finish your 5 minutes, spend 30 seconds doing deep belly breaths. In through your nose for 4 counts, out through your mouth for 6 counts. Do that 5 times. Why? Because balance isn't just physical, it's neurological. And slow, deep breathing activates your parasympathetic nervous system, which helps your brain process and lock in the motor learning you just did. Think of it like saving a file on your computer. The breathing is the save button. And over time, that combination of movement plus breath creates a morning routine that improves not just your balance, but your mood, your focus, and your overall sense of control. Now, let's address the obvious question. Can you still walk? Of course. If you enjoy walking and it doesn't hurt, keep doing it. This isn't about replacing something you love, it's about adding something that covers the gaps. Think of walking as your endurance work and the 5-minute sequence as your strength and stability work. Together, they make you more resilient than either one alone. But if walking has become painful or discouraging, or if you simply don't have the time or the weather or the safe neighborhood to do it consistently, then this sequence gives you a powerful alternative that takes less time, requires no special conditions, and delivers results you can feel within days. I also want to talk about something that doesn't get enough attention: the psychological impact of feeling unstable. When you don't trust your body to hold you up, you start limiting your life. You stop going places. You stop trying new things. You start asking for help with tasks you used to do easily. And slowly, invisibly, your world gets smaller. That's not aging. That's deconditioning. And deconditioning is reversible. Margaret, Robert, and dozens of others I've worked with didn't just get stronger. They got braver. They started doing things again. They started feeling like themselves again. And that shift from fearful to capable is worth more than any medication or supplement. Here's the bottom line. Walking is great if it works for you. But for a lot of people over 65, it's not enough, or it's too much in the wrong way, or it's just not practical. The supported stand and shift sequence gives you a way to build the strength, balance, and circulation that actually prevent falls and keep you independent. It takes 5 minutes. It requires almost no space and no equipment. And it works. Not because I say so, but because the people who do it every day report feeling more stable, more confident, and more alive. And because surgeons like Dr. Feldman are seeing objective improvements in patients who were told walking was their only option. So here's my challenge to you. Try this sequence every morning for 2 weeks. Just 2 weeks. Set a timer. Do it before breakfast or right after you get out of bed. Notice how you feel on day 3, day 7, day 14. Notice if your knees hurt less. Notice if you feel steadier on stairs. Notice if you stop thinking about falling every time you step into the shower. And then come back here and tell me what happened. Which part of the sequence felt easiest? Which part challenged you the most? Are you going to keep going, or are you going back to walking? I want to hear your story. Drop it in the comments right now. Which change will you try first and why?